So now remember that I mentioned that without saliva, there is virtually no protection for our teeth. So we need to start implementing strategies to prevent acid erosion of our teeth or the destruction of the enamel. So the first one will be like, don't swish or swirl or hold acidic drinks in your mouth for too long. And that includes not only carbonated drinks or juices, cocktails, that sort of thing, but think about the coffee you drink in the morning or a cup of tea. Drink it within like 20 minutes or so. You finish it within like your meal time frame. Don't sip on that coffee for 2 or 3 hours at a time. Wait at least 30 minutes to brush your teeth after having acidic foods or drinks. By then, your enamel is no longer at its softest and most vulnerable. Instead, I will say rinse your mouth with Biotine, mouth rinse, or any of these dry mouth rinses, or just baking soda and water. What's important is to start reducing the acidity in your mouth. And lastly, just make sure that you brush your teeth with a soft bristled brush. And just like you see in that little teeth here, you want to make sure that you want to hold your toothbrush from the tip of the toothbrush. So then you don't put a lot of pressure, because that can further damage your teeth. So what are those best food pairings to reduce acid erosion when you're eating? So first of all, make sure that you choose foods that are easy to chew and swallow. Typically, dairy products like cottage cheese, ricotta cheese, yogurt, kefir, or their plant alternatives pair very well with fruits. If you are an occasional wine drinker, or you just enjoy, an occasional glass of wine, fermented cheese, it will be the perfect companion. And for when it comes to salads, like vinaigrettes are sometimes, it's like I have like a love and hate relationship. Balsamic vinegar is one that it tastes delicious, but it truly irritates my tongue. So I try to go very mild on my vinaigrettes. I try to buffer the acidity with a little bit of honey or maple syrup. Also adding vegetables with a high water content like cucumber, zucchini, eggplant, adding high fat fruits. So that means avocado. Also adding roots like sweet potato. All those things helps to buffer that acidity and helps relieve pain. So what about water? Oh, let me share this with you. Flax seeds and chia seeds contain a substance called mucilage, a type of soluble fiber that when mixed with water would release a sticky kind of jelly-like substance that adds viscosity to the water. Plain water will wash away the tiny amount of saliva that you produce when you have Sjogren's or extreme dry mouth. So please share with. That's right. So water will flush away this small amount of saliva. So sometimes when you drink water, you feel like you're drier afterwards. So the flax water is something is anecdotal. Again, there hasn't been a lot of information or research done on how to alleviate dry mouth in Sjogren. So this is something that has been anecdotal, is not going to be harmful unless you have an allergy to flax. And so this is a very easy way to add some viscosity to your water and find more lasting dry mouth relief. But let's say you can't tolerate flax or chia seeds. So there is a commercial product used to thicken water and fluids to facilitate swallowing. There are actually several products, but the one that I'm most familiar with is with the Nestle Thicken Up Clear. Those thickening agents, if they contain xanthan gum, like Thicken Up Clear, it seems to be more consistent. You can keep it in the fridge and it's still going to remain thickened. So depending on the degree of dryness and swallowing difficulties, which should be assessed by a speech language pathologist or dietitians, so thickened fluids can significantly aid the mixing of foods in the mouth and the lubrication of the esophagus. Again, this is an area that had been hardly explored in patients with Sjogren's. And I'm here bringing this to you as a patient and as a dietitian and former dysphagia clinician. Now, the fun part. Sjogren's oral care relief routines. And this is what I wish I had 20 years ago when I was diagnosed with Sjogren's. Because you can see everywhere, use this, use that, but it's like, how do I use it? So I created a routine. So the day routine will be before and after meals and snacks. As a reminder, wait at least 30 minutes to brush your teeth after having acidic foods or drinks. Rinse your mouth with baking soda and water, or dry mouth oral rinse before and after meals. And that will help to add as a buffer and reduce the acidity in your mouth. Remember, that acidity not only will increase your dry mouth, but it also increase the risk of cavities. Use a water flosser or floss picks or both, whichever you feel comfortable. Brush your teeth, use soft bristle toothbrush. I found that the bamboo or the children's electric toothbrush, they're actually a pretty good alternative. Use dry mouth or children's toothpaste with fluoride. But keep in mind that even children's toothpaste may contain SLS. So read the labels. This particular chemical is the one that gives the foaming aspect of the toothpaste, and it could be highly irritating of the oral mucosa. You know, there are many dry mouth products out there, mouthwashes. So make sure to use one at a time and then assess which one works best for you. Because if you use them all at once, then you don't know which one is actually working. So we continue. It's not only before and after meals, but what happens in between. So if you have to speak at work, or you have to or you're exposed to air conditioning spaces, make sure that you apply saliva substitutes 1 to 2 sprays every 1 or 2 hours. It's almost like taking care of your eyes, that you have to put eye drops every couple of hours. Use gum or lozenges containing xylitol. I alternated, because if I chew gum constantly, I'm going to cause like a jaw pain. So we also have to be very mindful of the temporomandibular disorder that can be present in patients with Sjogren's. You could apply moisturizing gel or coconut oil on the tongue or dry parts of your mouth. You could use products like Xylemelts or Stir Strips, and that can help to relieve dry mouth. Now, for the bedtime routine is slightly different, because we remember that we don't have saliva to constantly be remineralizing our teeth. So that's why we are suggested to use a high fluoride toothpaste at night, and visit the dentist and the oral dental hygienist minimum every 3 to 4 months, so we can have access to a fluoride tray. Also use a high fluoride mouth rinse. Make sure that you don't drink anything for 20 minutes. You can alternate the high fluoride toothpaste with a remineralizing toothpaste at least 3 times a week. Apply dry mouth gel. If it's possible, wear a mouth guard because that is going to kind of give the illusion to your mouth that there is something in your mouth, so it triggers to stimulate saliva. Apply Silomelts or syrup strips as well. Use a humidifier at bedtime. Make sure to keep the humidity between 40-50%, 50%, especially when the air is very dry. You don't use a humidifier if there is a high humidity because you don't want to cause the production of mold in your house, which is very toxic. So balance is key. And of course, keep water within reach at night table. But I'm hoping that these routines will truly help you not to wake up at night and interrupt your sleep because of your dry mouth. So another strategy is the coconut oil pull-in, which I learned is an ancient Ayurvedic therapy for maintaining oral hygiene. So I came to learn about this therapy because I participated in a study conducted by Dr. Lane. She is the president of the Sjogren Society of Canada, an immunologist and orthodontist. And she did a small study with a few of us doing a coconut oil pull-in every night for at least 30 days. And she found that there was a reduction in plaque accumulation in cavities as well. And why is that? Some potential, what is it, is the content of lauric acid, which can react with alkalis present in saliva to form a soap-like substance, which reduces the plaque adhesion and accumulation and possesses that cleansing action. How do you know that you're doing the oil pull-in properly? So with Dr. Lane, we learned that between 10-15 minutes should be a good time to do the coconut oil pull-in. However, you may want to expand that up to 20 minutes because you want to have almost like a liquid substance in your mouth. And I also found it effective to gently massage my salivary glands while I'm swishing the coconut oil in my mouth. Make sure that you don't spit this into your sink. Spit the oil into a tissue. You don't want to cause any clogs. And rinse out your mouth with water. There is a school of thought that you can do this first thing in the morning with Sjogren's. Could be a good idea to do it at night because that oil will stay in your mouth and keep it nice and moist. You will find what is the best time for you. Just to be mindful of the time, I'm going to share this link of how to conduct the salivary gland massage and warm compresses. That would also help to relieve the pain and to hopefully stimulate more saliva production. Now, as a reminder, always don't forget to assess your hydration status. I have found that sometimes it's never the idea that we get used to dry mouth, but we get used to keeping something in our mouth, chewing gum or candy, a lozenge or something. And we might forget to actually drink enough fluids. So it's not about like how many cups of fluids you drink, right? You know that the norm is between 7 and 8 cups of fluids, and that includes everything, including water. But you want to make sure that you have a good renal function or kidney function, and strive for more like a lemonade color type of your pee. Remember, the darker it gets, the more the body's telling you, hey, start hydrating me more. So with that, I'm going to leave this slide. If after watching this recording, you have any question, please let me know, send me an email or post it in the Facebook community. And on July 8th, I will be presenting to you safe swallowing strategies that I learned as a dietitian, former dysphagia clinician, and as a patient.